in Connecticut. Hey, Kim, thanks for the phone call. You are live.
Thank you so much. I've been on your gluten-free diet for about 2 to 3 months, and I have been following the good foods, bad foods.
Yeah, good girl. Did you notice any difference?
Well, not really. The only area where I haven't been perfect has been the oil, just because sometimes it's hard.
Yeah, it is.
Especially when you eat at other people's houses.
I know. That's a kicker, isn't it? Isn't that a kicker?
Yeah. So that's the tough part, but I mean, I've been following it otherwise when I'm in control.
All right. Now, are you taking the supplements?
No, and I need some guidance with that, but I thought first, and I know this is a long list, I'm sorry, but this is what I live with. I wanted to give you a list of the issues I've been dealing with that I've been trying for years to get rid of.
Okay, great. So I'm sitting down, so hit me.
Oh, good. I'm glad you're sitting down. So I have psoriasis.
Yeah.
I have Fuchs dystrophy. I don't know if you know what that is.
I know what that is. Yeah.
Yeah. I have yeast infection.
Yeah.
I have sleep issues, and I take GABA and valerian root and some other herbal remedies and melatonin.
All right, good. Well, tell me this, Kim. Is the sleep issue difficulty falling or difficulty staying asleep?
Well, when you take all those things, it's easy to fall asleep. It's then staying asleep. So I can't tell you about the falling. Because
you're taking all the stuff to make yourself fall asleep, right?
Right. But I hear, if anybody comes in the bedroom, I hear them walking.
Yeah.
So you see, I'm not getting sound sleep.
One more thing before the break. Yeah. One more thing. Psoriasis, yeast, sleep issues.
I'm sorry, you want to ask me a question?
Yeah, no, I want you to keep going with your list. We got 20 seconds here.
I have swollen lymph nodes.
Yep.
I have migraines.
Yep.
Hypothyroidism.
Back, finishing it up today with Kim from Connecticut. All right, Kim, you still with me?
I'm still with you, so I don't know where I left off.
All right, so let me, all right, we only got 5 minutes here, so we're going to have to be quick. I'll tell you what I've got. We've got psoriasis, yeast infection, sleep issues, swollen lymphs, migraines, hypothyroid, bunions, plantar fasciitis.
And allergies.
Allergies, all right, good.
Now, I'm not sure if my swollen lymph nodes, I was diagnosed with DCIS, which is really not a cancer these days, about 3 years ago, and I had 3 lymph nodes taken, which were clear.
Yeah.
And, of course, you go through nuclear medicine to have that done, so I'm not sure whether that was what inspired my swollen lymph nodes.
Well, you would think, right, that even after an insult like that were everything okay in Dogtown, that your body would have recovered from it, right? I mean, if you pull a splinter out of your arm, you don't expect the inflammation to last for more than a day, right?
I know. So they're of concern. So, I do take vitamins, but I think I'm not taking enough of the right things, and that's why I need guidance from you.
All right. Well, that makes you the smartest woman in Connecticut, and this is our whole. This is our whole thing. This is our whole thing.
Absolutely.
Not all wines are created equal. They're all made from grapes, but there's a great deal of difference, right, from bottle to bottle. It's the same with vitamin supplements. No kidding.
I understand.
All right. So psoriasis, from our point of view, is oxidative damage to the skin, in addition to not enough antioxidants inside the body to take care of the insult. And, oxidative damage is everywhere all the time. So you need a little extra skin support, and you need a little extra antioxidant support. Yeast infections most of the time are caused by blood sugar issues, as are yeast infections. So those two things go hand in hand. The swollen lymph glands can be caused by any number of different things. Migraine headaches most of the time is a lack of your body's ability to produce a prostaglandin, and prostaglandins are manufactured in the body by essential fatty acids. So if you're EFA deficient, you're going to be prostaglandin deficient, and you're going to be a candidate for migraine headaches. And calcium and magnesium also come into play here, because calcium and magnesium are important for the proper dilation or lack thereof of your blood vessels, which is
right.
interesting.
I have been able to help my migraines. They used to be 50% of the time, but it's gotten down to much better with niacin. That's helped me.
Well, that's interesting. Now, niacin is kind of a backdoor treatment because niacin won't get to the root cause of the migraine, but it will mitigate. It'll mitigate the intensity of the migraine.
Because it's a vasodilator.
Yeah, that's right. Kind of like taking an aspirin, right? So,
right.
All right. Now, so plantar fasciitis and bunions are calcium and magnesium deficiencies, and hypothyroid is often a deficiency in selenium, copper, and iodine. So,
okay.
Now, regretfully, I only have 2 minutes left. So, how much do you weigh? What's your current body weight?
165 pounds.
All right. So here's what I would do every month for the first 90 days. Every month for the first 90 days, I would do one anti-aging Healthy Start Pack, one anti-aging Healthy Start Pack,
okay.
4 bottles of selenium, 4 bottles, well, the technical term is ultimate selenium, 4 bottles of ultimate selenium.
Right.
1 bottle of EFA Plus. You're already going to get 1 bottle of that in the Healthy Start Pack, but I want you to do 1 extra bottle of EFA Plus because of the psoriasis.
Right.
And I'd like you to do 1 bottle of glucogel at the 240 count. 1 bottle of glucogel at the 240 count. And last but not least, 1 bottle of Sweeties. 1 bottle of Sweeties. Now, you also must secure in your diet 100,000 ORAC points, O-R-A-C, of antioxidants.
Right, I'm familiar with that. Now, how do I do that? Because right now I live on protein and vegetables.
All right, well, then you're going to need supplements. So you can do a little Google search.
Well, I do curcumin and, turmeric.
Turmeric, all right, so green tea, walnuts. But you're going to have to educate yourself.
Oh, I'm pretty educated, so.
All right, the food value of the ORAC value of foods, with your goal being 100,000. The easiest way to do that is with a longevity product called Triple Treat Chocolate.
Okay.
There's 19,000 ORAC points in 1 piece.
Okay, that sounds delicious.
Which is pretty good. And in the anti-aging Healthy Start Pack, there's a product called Cell Shield RTQ. You're going to already be getting that. There's in 1 capsule of that product, there's 8,000 ORAC. Wish we had more time. Thanks, Kim.
Thank you, Dr. Glidden.